Stop and think for a moment about the last time your doctor checked in on your diabetes. What did they measure? Your blood sugar, maybe your A1C, and that was probably it. Here's what most people don't realize. If that's all you're getting, you're only seeing a tiny fraction of what diabetes is doing inside your body right now. Diabetes doesn't just live in your blood sugar. It silently damages your kidneys, your heart, your nerves, your thyroid, and your immune system, often for years, before you feel a single symptom. And right now, there are 10 blood tests that could reveal what's really going on. Most doctors never order them unless you ask. So today, that's exactly what we're going to fix. I'm Dr. Sarah Mitchell, and this channel exists to give you the evidence-based information you deserve, the kind that's grounded in current research and designed specifically for adults over 60. If that sounds like what you've been missing, subscribe now so you never miss a video that could genuinely change your health. Now, let's get into all 10 of these tests, because some of what I'm about to share will genuinely surprise you. Let's start with the one you probably already know and work our way toward the ones that almost nobody gets. The first is your HbA1c, or glycated hemoglobin. This measures your average blood sugar over the previous 2 to 3 months. Most doctors target below 7%. But here's something critically important that doesn't get discussed enough. Updated guidance from the American Diabetes Association now specifically recommends that adults over 65 may be safely managed at an A1C between 7.5 and 8%. The reason is that aggressively pushing your A1C too low in older adults actually increases the risk of dangerous hypoglycemic episodes, low blood sugar events that can cause falls, confusion, and cardiac events. If your doctor is pushing hard to get you below 7, ask whether that target actually makes sense for your age and your overall health picture. The second test is fasting blood glucose. This gives a morning snapshot before food. For well-controlled diabetics, the goal is generally under 130 milligrams per deciliter. One thing that trips people up is interpreting this number in isolation. Poor sleep, high stress, even a sip of black coffee can push it up artificially. Always look at fasting glucose alongside your A1C, never on its own. Now, here's where things get important. The third test is your eGFR, which stands for Estimated Glomerular Filtration Rate. This tells you how efficiently your kidneys are filtering your blood. Diabetes is the #1 cause of kidney failure in the United States, responsible for approximately 44% of all new cases, according to the National Institute of Diabetes and Digestive and Kidney Diseases. Up to 40% of people with type 2 diabetes will develop some degree of kidney disease, and most won't know it until significant damage has already occurred because early kidney decline causes no symptoms at all. An eGFR above 60 is generally acceptable. Below 45, your doctor should be actively involved in protecting your kidneys. Below 30 is serious. This test should be done every 6 months, not once a year. The fourth test is the urine albumin to creatinine ratio, or UACR. This is actually a urine test, but I'm including it here because it's so critical and so often skipped. It detects tiny amounts of protein leaking into your urine, a sign of kidney stress that shows up years before your eGFR even begins to drop. A landmark trial published in Diabetes Care demonstrated that catching this early and treating it aggressively can slow kidney decline significantly. Ask for your UACR by name at every annual visit. Most patients I talked to have never heard of it. Comment below right now. Has your doctor ever ordered a UACR? Type yes or no. I genuinely want to understand how many of our community members are getting this test. The fifth test is a comprehensive lipid panel. You probably hear about cholesterol all the time, but for diabetics, there's a specific piece of this that most doctors underemphasize, and it's your triglycerides. A 2023 meta-analysis published in the Journal of the American College of Cardiology found that in people with diabetes, elevated triglycerides combined with low HDL predicted major cardiovascular events more accurately than LDL cholesterol alone. Diabetics face 2 to 4 times the cardiovascular risk of non-diabetics. You need the full picture. LDL, HDL, total cholesterol, and triglycerides. Triglycerides above 150 milligrams per deciliter are a concern even when everything else looks normal. The sixth test is one that genuinely surprises people. Thyroid stimulating hormone, or TSH. Your thyroid has more influence on your diabetes than most people realize. An underactive thyroid causes insulin resistance, unexplained weight gain, fatigue, and elevated cholesterol, symptoms that look almost identical to poorly controlled diabetes. Up to 30% of women over 60 have some degree of thyroid dysfunction, and a significant portion of those cases go undiagnosed. A study from the Cleveland Clinic found that treating undetected hypothyroidism in diabetic patients improved their A1C by an average of half a percentage point without any change to their diabetes medications. Margaret, a 68-year-old retired teacher, had acceptable A1C readings for 4 years while constantly feeling exhausted and experiencing tingling in her feet. When a new physician finally ran a full panel, her TSH came back dangerously elevated. She'd had undiagnosed hypothyroidism the whole time, silently undermining her metabolic control. But here's what shocked me the most about this pattern. Margaret's previous doctor had been increasing her diabetes medication every year, trying to compensate for worsening numbers. The root cause was never tested for. One simple blood test would have changed her entire treatment path years earlier. The 7th test is your vitamin D level. Research published in 2021 from a TUS University study involving over 2,400 participants found that diabetics who maintained vitamin D levels above 40 nanogs per milliliter had meaningfully better blood sugar control and significantly lower rates of diabetic complications. The minimum threshold of 20 nanogs that many labs flag as adequate is not the target for optimal metabolic function. You want 40 to 60 nanogs per milliliter. When you ask for this test, specify a 25-hydroxy vitamin D test. The specific name matters when ordering it. The 8th test is vitamin B12. This is absolutely essential if you take metformin, which is the most commonly prescribed diabetes medication in the world. Metformin interferes with B12 absorption in your gut over time. Research published in the British Medical Journal estimated that up to 30% of long-term metformin users develop measurable B12 deficiency. Here's why that matters so much. B12 deficiency causes peripheral neuropathy, the exact same tingling, numbness, and burning in your feet that people almost always attribute entirely to their diabetes. If you've been on metformin for more than 2 years, ask for a B12 test every 6 months. A reading above 400 pogs per milliliter is what you want to see. Many labs flag deficiency at 200, but symptoms can appear well above that level. The 9th test is serum magnesium. Diabetes causes the kidneys to flush excess magnesium through the urine. And research estimates that between 25 and 38% of people with type 2 diabetes have clinically low magnesium levels. Magnesium is required for over 300 enzymatic reactions in the body, including every step of the insulin signaling process. Without enough magnesium, insulin literally cannot do its job properly. A large meta-analysis published in Diabetes Care showed that diabetics with the lowest magnesium levels had the highest A1C readings, and supplementing magnesium in deficient patients reduced fasting blood glucose by an average of 5.4 millig per deciliter. This test is inexpensive, takes 30 seconds to add to a lab order, and is almost never ordered. Ask for it. Comment your age and how long you've been managing diabetes. I'm genuinely curious about our community, and I read every response. The 10th and final test is high-sensitivity C reactive protein, or HSCP. This is an inflammation marker. Chronic low-grade inflammation is one of the primary drivers of both insulin resistance and cardiovascular disease in diabetics, and an elevated HSCP is a powerful predictor of heart attack risk. Research published in the journal Circulation found that diabetics with HSCP levels above 3 millig per liter faced nearly triple the risk of a major cardiac event compared to those with low inflammation. Your target is below 1. Between 1 and 3 is moderate risk. Above 3 means active vascular damage is occurring, and it needs addressing. Frank, a 71-year-old from Florida, had controlled blood sugar for years, but kept experiencing mild fatigue and occasional chest discomfort that his doctor dismissed as anxiety. When a cardiologist finally ran an HSC-CRP, it came back at 6.8 with targeted changes to his lifestyle and a medication adjustment. His number dropped to 1.4 over 8 months, and the chest discomfort disappeared. This next part is exactly what you need to bring to your doctor. Here's the complete list: HbA1c, fasting blood glucose, eGFR, urine albumin to creatinine ratio, full lipid panel including triglycerides, TSH, 25-hydroxyvitamin D, vitamin B12, serum magnesium, and high-sensitivity CRP. Write that down. Your A1C and fasting glucose should be checked quarterly. Your eGFR and UACR should be done every 6 months. The remaining tests should be annual at minimum. And if you've been on metformin for more than 2 years, add B12 to your 6-month labs. When you talk to your doctor, be specific. Don't say, "I want more tests." Say, "I'd like to add these specific panels." Doctors respond to specificity. If a test is declined, ask for the reason. You have every right to advocate for your own health. If your vitamin D comes back below 40, discuss supplementation with your doctor before starting anything. D3 combined with K2 in a dose of 2,000 to 4,000 IU daily is commonly recommended for deficient diabetics, but the right dose depends on your baseline. If your B12 is low on metformin, ask specifically about methylcobalamin. It's better absorbed than the standard cyanocobalamin form. A typical supplementation dose ranges from 1,000 to 2,000 micrograms daily. And if your magnesium is low, magnesium glycinate at 300 to 400 milligrams daily is the form most easily tolerated by the digestive system. Always discuss these choices with your physician before beginning, particularly if you have kidney disease, as magnesium clearance can be affected. If you're on blood thinners or ACE inhibitors, your doctor may need to sequence these tests and any treatment adjustments carefully. Here's the bottom line from today. Managing diabetes after 60 means looking at the whole picture, not just your blood sugar. These 10 tests are your early warning system for kidney disease, cardiovascular inflammation, thyroid dysfunction, neurological damage, and nutrient deficiencies that quietly make everything worse. Most of them require nothing more than asking. If you're going to bring that list to your next appointment, comment testing now below. I want to know who's taking action. And if you have a spouse, sibling, or friend with diabetes who needs to hear this, please share this video with them today. One conversation could genuinely change what happens to them next year. Subscribe if you haven't yet, because next week we're covering the 5 foods that millions of seniors with diabetes eat daily while believing they're making healthy choices. And the truth about them is going to be eye-opening. I'm Dr. Sarah Mitchell. Stay informed, stay proactive, and I'll see you in the next